Hey guys, it's Jules. Welcome back to my channel. So today we are going to be talking about a procedure that I had done about a week ago on my right leg. It was for varicose veins. It was called a phlebectomy, which is surgery for varicose veins. It's surgery, but you stay awake and it's an outpatient thing. It's about an hour long, really not that big of a deal, but still a surgery. And I noticed a lot of people taking interest in the surgery when I mentioned to my friends and family that I'd had it done. So I thought, it's probably a good thing to make a video about in case any of you guys suffer from varicose veins. It might be something that you want to look into in the future. I have done my left leg already and it had amazing results. Everyone's experience is different and it's, at least for me, helpful before I get a procedure like this done to hear other people's stories, other people's experiences, and then I can judge for myself what I want to do. I'm going to start with a little warning on this video. There's going to be medical descriptions of things happening. There's going to be probably a couple of pictures. If you are triggered by that kind of thing, which I know that I can be, please click off the video because I don't want this to make you feel sick or ruin your day or anything. So yeah, just be forewarned. I started noticing that I had varicose veins when I was in my mid-20s. This is something that is hereditary generally, but neither of my parents have it. So I'm guessing that somewhere down the line, grandparents or great-grandparents had this and they passed it on down to me. One thing I noticed people getting a little confused about was the difference between spider veins and varicose veins. You might have spider veins, you might have varicose veins, you might, like me, have both, but you should know what the difference is. So let me post a picture here, first of all, of spider veins and then varicose veins so you know what we're dealing with and what the difference is. So as you can see, spider veins are a bit more of like a surface issue. Those are really easily fixable. They basically take a saline injection and inject it into the vein, and you literally watch the vein disappear on the spot, in and out. I think I had that procedure done when I was 12 because I've always had vascular issues. I just never really, it got worse with age, as it usually does. So yeah, when I started going through puberty, I developed spider veins, got rid of those, and then in my 20s, I got varicose veins, which, as you could see by the picture, are a little bit more in depth and gnarly. They bulge, they ache. A varicose vein is basically a vein that your body creates that is completely superfluous and unnecessary. The body is a really incredible thing. It does a lot to protect itself, to build up its own immune system, to make sure things are functioning. Sometimes it overachieves. My body is an overachiever when it comes to veins. That's what I tell myself to make myself feel better. So basically my body produced these extra veins and they're sitting right at the surface, and the blood, it starts to pool in the vein. And I know that can be that's a little gross. So the beauty of the surgery is that they can literally kill this vein because it's not needed in your body, and then remove it. And then after a little bit of recovery, your legs are smooth as silk and they look like they've never had a vein there before, and it's awesome. So what do you do if you have varicose veins or you're considering varicose vein surgery? Well, the first thing you're going to do is find a vein clinic, and that is literally as simple as Googling vein clinics near me, finding the place with the best reviews of the best doctors and going there. Now, the first thing they're going to do is called a venous ultrasound. That's basically like an ultrasound that they would do on your tummy if you were pregnant, but they do it on your leg. And they'll show you all of the veins that aren't working, all of the veins that aren't opening and closing properly. And at the end of your appointment, they'll be able to tell you if you are a candidate for the surgery. Now, here's the slightly annoying part. You have to wait something like 60 days in which you don't get the surgery, but you first try to wear compression stockings to help your varicose veins. Now, this is a compression stocking. I have two. They will give you two. They're about $65, so not cheap, but one pair. I mean, they're so durable, like this will last you forever, and they really do help. Sometimes you'll see like athletes wearing these. Basketball players will wear them on their legs or on one arm. You'll see these long, like black stockings. That's what this is, and what it does is it it squeezes your leg, your arm, whatever you have it on, so that the blood flows more easily up and down. Some people with varicose veins can get by just using a compression stocking, which is fantastic, and you don't have to get the surgery or anything. I was not one of those people, but I did try these stockings for about, however long they told me to. And then I called them up and I was like, yo, this is still not working for me. So then at that point, they submit your stuff to insurance. And at that point, they will allow you to get the surgery. On the day that you go in for the surgery, it's really easy. There's really nothing extra that you need to do or not do. There's nothing you have to eat or drink or can't eat or drink. You just kind of live your life as normal. And the day of the surgery, the only thing that they'll give you is a little bit of Valium to calm down and relax because you are awake during the surgery. Basically, what they're going to do is take a little needle or a little vein catheter and put numbing solution into the vein. This is like a little sting at most. It's really not that painful. They just numb up the vein from the bottom of the ankle all the way up to the groin because the vein actually goes up your entire leg, even though it looks like it's just maybe a little piece. It's connected to everything. So they numb the whole area, which is like slightly uncomfortable, but not the worst. At this point, you're going to be feeling relaxed and good. And then what they do is they take a laser and they actually shoot it into the vein. And this kills the vein. It does not hurt. It should not hurt. And part of the reason why they have to keep you awake is because if it starts to hurt, you have to tell them, because then they'll put more numbing stuff in you. They'll know that they're near a nerve and they'll be able to be careful and make sure that it does not hurt. The weird thing about the laser is that when they shoot the laser into the vein, you actually taste like ashes, like your mouth almost tastes like an ashtray. And the doctor who did my legs, by the way, I had Dr. Anderson from South Florida Vascular, and his bedside manner was amazing, and he's also pretty cute. So like that's just the basically best combination you can have when you go into surgery, don't you think? So Dr. Anderson explained to me that the ashtray taste would happen in my mouth. It did. And then he told me that I was the only one who could taste or smell it, which was pretty trippy. Don't let that scare you. It's just sort of a weird thing that happens. The very last step of the surgery is that after they kill the vein with the laser, they then go in with these little microscopic incisions and they pull out the vein. This, again, they numb you first, so you really don't feel pain. You just feel sort of like pulling and tugging. So the whole thing for me took about an hour to an hour and a half tops. And when you're done, they put these little like butterfly bandages over you. It's not even stitches. You can get up right away. The recovery part is really what I want to talk to you guys about more than the surgery, because the surgery is easy. That's in and out. It's an hour. You're numbed up. But the recovery is a little bit of a biatch. Walking is key. You are going to want to walk as much as you can from the second that you get out of surgery. They actually make you walk when you get out for 20 minutes. So your blood has to circulate. And the main reason for this is because the main complication from a phlebectomy is blood clots. Now it's rare. If you stay hydrated and if you walk, you're going to be fine, but you just want to take care of yourself and do the right thing. You're going to need to walk for 15 minutes every hour. This can be a little daunting and exhausting at first, but for the first few days, just set your timer. Every 45 minutes, get up and walk for 15 minutes, just to be sure that your blood is circulating. You're going to put the stocking on immediately after surgery. They'll put it on for you. They'll also wrap you up with gauze and stuff. You leave that on for 48 hours. Don't get it wet. If you're gonna take a shower, wrap your leg up in a trash bag and try to just like keep it out of the water. So after the 48 hours is up, you can remove your bandages and just do it slowly, do it carefully. I really recommend laying down for 10 minutes or so, just because the blood is going to start rushing into your leg. You've had this tight thing on for 48 hours. So some people can get lightheaded. I didn't. But just to be on the safe side, when you take off your stocking after 48 hours, just lie down for a few minutes. Then you can shower. You shower with your little butterfly bandages still on. You don't take them off or anything. They'll eventually fall off over time. I had my surgery done like a week ago, and my butterfly stitches are still on, but they're just starting to peel off at the ends. After the first 48 hours is when the pain for me started to come in. They're actually not even allowed to prescribe anything stronger than Advil or ibuprofen, which you take every 4 hours religiously for the first 3 to 4 days. Really just icing it for the first few days because you don't want to get it too hot, you don't want to take a bath, you don't want to inflame the blood vessels. So just a little bit of ice and elevation and a lot of ibuprofen or Advil, just something to take down the swelling. It does get quite sore, and the bruising, it does seem significant, but it will go away completely if you follow your aftercare instructions. This picture is something like 2 days post-op. It doesn't hurt as bad as it looks in the areas where it's really black and blue. Those are actually not the areas that hurt the worst for me. For me, the part that really hurt was up by my groin. I don't know if there are just like extra sensitive nerves and tissues and things up there. I think a lot of it was caused by the compression stocking. So don't be surprised or afraid if you get the surgery and then like your groin area starts really hurting because you have these tight like strips on the stocking that just hit that one spot on your leg, and the pressure can be painful. So that was one other thing that I did notice. Just know that it's normal. You had surgery, no matter how minor it is, and expect the pain for the first week or two to be, you know, somewhat significant. Days 7 and 8 are brutal, but once you get past that, it's all uphill. So during this time, you are not to be doing any heavy lifting, any heavy exercising for like 2 weeks. After 4 days or so, I started using a little heating pad as opposed to ice, and that felt really nice. The heat was pretty much the best thing for taking away the pain. So I really, really recommend getting a little like microwavable heating pad or something that you could just put up against the area. So traveling on a plane, it can increase your chance of getting a blood clot. I had to travel 1 week after my surgery. They said that was the earliest that I could travel. Everything was fine. The only thing that I had to do was get an aisle seat so that I could get up and walk around. Again, as long as you're walking, you're fine. One of the last things that they let you know is that you have to avoid exposure to the sun on the treated area for as long as possible. And if you do go into the sun, you have to use a strong SPF sunscreen because otherwise you can get some permanent like markings from the sun. There are really very few complications from this surgery. Again, blood clots would be the main thing. My doctor said the #1 cause of blood clots that he has seen is dehydration. So make sure that you are drinking a ton of water after surgery. And the other minor complication is that some patients, I guess, will have localized numbness. If your doctor gets too close to a nerve, they might hit I think it's called like a skin nerve, and it could make the area numb for a while until the nerve heals. Basically, that can be avoided by being aware when you're getting your surgery done, and if it starts to hurt, say something to your doctor and they'll stop before they get close to a nerve. I needed to do the front and back of my leg, and they did it back to back. Sometimes they'll schedule you for if you need more than one surgery. Sometimes they'll schedule it a month apart. Sometimes they'll schedule it 2 weeks apart. I had to travel, so I got mine done back to back, and quite honestly, it was fine. The leg was a little sore on the second surgery, but again, if you have the right doctor, the right medical team, they should be gentle, they should make sure you're comfortable, and then you should be just fine. I'm gonna try to show you my healthy leg that is now varicose vein free. This one I had surgery on about 2 years ago. So here's my leg. As you can see, like there's just absolutely nothing there. It's totally smooth. There are no marks, no nothing. It's as if nothing ever happened. My other leg, okay, time for gruesomeness again, is healing, but it's still got some, you know, pretty significant bruising going on. But just so that you can see a compare and contrast, this leg is going to look exactly like the other leg in just a few months time. So I guess as an overall, I would just let you guys know that I do recommend this surgery. If this is something that you're suffering from, if it's a hereditary issue you have, if you know you're noticing that you're developing this problem, it is something that can be fixed, and it is a medical problem, even though it's cosmetic as well, and insurance will help you out. Do your research, make sure it's the right thing for you. For me, it was the right thing. It's the only surgery I've ever gotten, and I'm really, really pleased with it. So that is my video for today, guys. If you have any questions, please comment below. And if you haven't done so already, subscribe to my channel. So I'll see you guys soon. I hope you're all doing great, and I love you lots. Bye.